Hi Besties, and welcome to another episode of Level Up with the Team Right Squad, your guide to navigating life as a young person. I'm your host, Demi Mashweshwe, and now we have another amazing guest from Ipas who is here to tell us all about it and what exactly they do. Hi Mama, how are you?
I'm well, thanks. How are you?
I'm good, thank you. Thank you so much for honoring the invitation. Before we start with the Ipas related questions, please tell us a little bit about yourself and what you love about you.
Thank you, and thanks for the invite. My name is Matokgo Makutoane. I'm a health systems advisor at Ipas. What is it that I can tell you about myself? I'm an activist, and I love that about myself.
Yeah.
That I stand for women's rights. And I think for now that's what I can share about myself.
Beautiful. So now, please tell us about Ipas. What is Ipas, and what do you guys do, or what work have you done in South Africa?
Okay, Ipas is an organization that actually has been in existence for 50 years. Can you believe it?
Wow.
I think last year we celebrated 50 years, and has been in South Africa since 1996. When abortion became legal in South Africa, and left South Africa in 2014 and came back in 2017. So Ipas is an organization that actually believes in women's rights and a specific focus on supporting women's rights to choose, especially to support women's right to accessing safe abortion services. So we support governments in countries where we work it up in 4 continents, where we support governments on making sure that providers are trained to support women to access safe abortion services and contraceptives and other services.
Yeah.
SRHR related.
Yes.
Yeah.
So I've browsed through your website, and you talk about strengthening abortion ecosystems. And I mean, those are very big words. So for someone that doesn't know, in simpler terms, how would you explain that?
All right. In simpler terms, what I can say is that we look at a system. We put a woman in the center, and we look at systems around this woman.
Yeah.
What will support this woman when she finds herself in a situation where she wants to terminate a pregnancy? So what are those things in a system that will support her or not support her? So we would look at a public health system mostly, because that's where people access health services. So we would look at health systems, whether there's finances in a health system, whether they are able to finance sexual and reproductive health services, whether they finance abortion services, whether the policy and legislation in that country support this woman in the center, whether there's a health workforce, there are private providers who are actually able to provide this woman with a service when she does go to the facility to request the service, whether there's data that supports the government to make those decisions, and whether there's commodities, because these kind of services don't just happen if there are no medications and equipment that is needed. So an ecosystem that we're talking about in this case is all those things that need to be in place to support a woman who has decided at that stage, under certain conditions, that I need to have an abortion. SRHR-related issues are very stigmatized, because we work in this space as well. And abortion is even much more stigmatized. So when we deal with abortion-related issues, we do not disregard people who may have different opinions about it.
Yeah.
So we know that we have the religious sector, we have people who may oppose it because based on their cultural beliefs. Our issue is around saving women's lives and making sure that the service is there for women when they need it.
Yeah.
So we don't encourage women to go and have an abortion. What we are saying is when a woman needs it, the service is there, and for them to access it, it has to be a safe service.
Yes.
And so that they don't find themselves accessing services that are unsafe and then end up dying in backstreet alleys. Coming from an apartheid past, before abortion became legal in the country. I mean, in the past, yes, in South Africa, I mean, white women used to access abortion privately because they could afford it or go overseas. But black women used to die in facilities because they couldn't go anywhere. And we know that maternal mortality, women dying due to pregnancy, was high during the apartheid days because women could not go anywhere if they don't want a pregnancy or they find themselves pregnant. And so we know that since abortion became legal, the numbers of women dying from backstreet abortion have actually gone down. And so there's data to support the reason why abortion should be legal. And even in countries where abortion is legal, there's evidence that shows that where abortion is legal, the numbers of women dying is actually lower than in countries where abortion remains very restricted. We don't disregard what people are saying, but let's look at what the facts are telling us in front of us so that we don't lose women because of cultural and religious beliefs.
Definitely. Yeah. So I know that, part of the work that you do, or majority of the work that you do, encourages abstinence and, responsible sexual behavior amongst adolescents and young people. So how can we as young people, amplify your work to try and make it easier for you guys to also reach your goal?
Yeah. I think having done some work around comprehensive sexuality education, and I think there's nothing wrong in abstaining.
Yes.
But I think what is also fair is making sure that we give accurate information so that young people make decisions based on accurate information.
Yes.
When you do decide to abstain, you abstain, but you have information. When you do decide not to abstain, you have accurate information. You also know that if I don't abstain, if ABC happens, then where will I go?
Yeah.
If I do abstain, this is what will happen as well. So I think our point is give young people accurate information on sexual health, so that they know how to deal with the repercussions that comes with abstaining or not abstaining.
Yeah.
Yeah, but not channel them towards only abstinence, only information, which is quite dangerous.
Yeah.
If we do that wrongly.
Yeah.
Yeah.
So I remember last year, I think around April, you had a week with young people from different communities, and basically, abortion was one of the core discussions of the whole engagement. So what were some of the findings from young people regarding the engagement?
We actually came up with an advocacy manual. We're trying to compare the work that we do in South Africa and with the work that we do in Malawi and Zambia, looking at our youth engagement and how we can work together as countries in the South, in the Africa Southern region, to strengthen our advocacy work, so that when we engage at the in our parliamentary focus discussions, then we have a stronger voice that will speak to the issues that affect young people. So what came up was still the fact that Malawi, I think, has more restrictive laws than South Africa. Abortion is legal, of course, but being legal does not mean there's access. As you well are aware that there's still challenges with access, and Zambia also does have a bit of a liberal law, not as liberal as South Africa is, but not as restrictive as Malawi is. So we were piecing together all that together to come up with strategies that will support our work to make sure that we save young people's lives, and we actually strengthen our advocacy strategy in the region to save women and girls. It's always good to work with community-based organizations, because that's where we actually continue to work with organizations that actually align with our objectives. We are able to reach communities better when we are working with organizations that are actually on the ground and are able to reach people better. We actually will be working with some other community-based organizations in KZN and Eastern Cape, and we'll also be reaching young people there as well.
Yeah, that's so beautiful. So, besties, you've heard it all for yourself. Please make sure that you gather information more about Ipas, and also remember that you can actually get access to free abortion at your local clinic facilities. So do make sure that you also check out for our website so that you can get more information on this. Remember, safe abortion, but also safe sex. Okay? So let's take it to the next level.